falling and staying asleep can be a common problem among not just adults, but children and teenagers. Many parents have turned to melatonin as a sleep aid, but is that a safe solution? Some insights into that from Dr. Reena Mehta with Uptown Allergy and Asthma. Good morning to you.
Good morning.
When I read the percentage in one study, it's a really significant percentage of people who've given their kids a little melatonin.
Exactly. So a recent survey from the American Academy of Sleep Medicine showed that 46% of parents have given their child or teenager melatonin to help as a sleep aid.
So the question is this a good idea?
Yeah, so that is a loaded question. So melatonin is a hormone. And so basically what it does is it's there to reset your circadian rhythm to help you fall asleep. Now, because it is a hormone, it is lumped into considering to be like a dietary supplement. And so it doesn't undergo FDA regulation like your normal medications or even over-the-counter medications would. And so there's a lot of variability that can come with it.
And I think that's a really important point, not just for melatonin, but when you pick up anything from the supplement line. And there are lots of really, believe me, I've gotten all kinds of emails from people over the years when you start criticizing supplements. But it doesn't have the kind of rigorous standard. So any time you're looking at a supplement, what should you be thinking as a patient or a consumer, if you will?
So you want to just not take it for face value. You want to understand that because it is not FDA regulated, it does not have the same long-term data, the long-term studies to show its safety profile. Now, again, melatonin is something that probably is safe, and I'm not sitting here saying don't use it. I've certainly used it. But that being said, just be aware that when it's not FDA approved, there's a lot of variability in dosing. So for example, you can have a chewable tablet and it could have half the amount of dose or 4 times the amount of dose, and there can be dose-to-dose variability, so it's not always the same with every measurement.
So don't start one brand and then switch to another brand or something like that.
Try to get a pharmaceutical approved brand if you can, because that does exist. And so just, for parents, be aware that you don't want to necessarily use it as a crutch. You don't want to maybe use it every day. Try to think of a better sleep hygiene, better sleep techniques, or if you're thinking about using it, definitely talk to the pediatrician or your doctor.
And forgive me, I misstated that. Don't switch from one brand of gummy to another without looking at the dosage is what
Exactly. Just because it's natural doesn't always mean it's safe.
That was my next question, because somebody might look at this and say, well, what's the problem with this? I mean, it occurs in nature. You're always telling us eat stuff that occurs in nature.
But even nature in high doses could be dangerous. So just be aware of the dosing. Just because you use higher doses doesn't mean it works better, because then you could have side effects.
Is there so from a parent standpoint, if you've got a child who, for whatever reason, is really having trouble with sleep, what would you suggest?
So, of course, trying to get to bed in terms of a routine, unplugging devices at least 30 minutes before going to bed. Things that can be really helpful for sleep are a warm bath before, hot tea, things like that. Try that first. And of course, if you're still having trouble having your child fall asleep, then talk to your doctor. And if your doctor recommends melatonin, then of course, I'm not saying don't use it. You can certainly try it, but just be aware of some of its limitations.
All right, Dr. Reena Mehta, thanks as always.
Thank you so much for having me.